The Agenda with Steve Paikin is made possible through generous philanthropic contributions from viewers like you. Thank you for supporting TVO's journalism.
Tonight, we unpack the misconceptions behind ADHD, attention deficit hyperactivity disorder. Then, children's entertainment icons Sharon and Bram return to TVO to discuss their new album. That's next on The Agenda. Attention deficit hyperactivity disorder, or ADHD, is a commonly diagnosed neurodevelopmental disorder in children and adults, but advocates argue very misunderstood. Here to provide us with a better understanding of what it is, or isn't, we welcome Dr. Duran Almagor, child, adolescent, and adult psychiatrist at the Possibilities Clinic and the chair of the CADRA Advisory Council. Heidi Bernhardt, founder of the Centre for ADHD Awareness Canada and a former psychiatric nurse. And Caitlin Weinstein, psychology student at the University of Guelph, who was herself diagnosed with ADHD at age 7. And it's great to have you three with us around our table here tonight at TVO. We're going to put some stats on the record here. I'm going to ask our director, Sheldon Osmond, to bring this graphic up. We'll go through some stats and then come back and chat. Here we go. ADHD, attention deficit hyperactivity disorder, is a chronic neurodevelopmental disorder. It affects about 5% to 9% of children and 3 to 5% of adults. It's the most common neurodevelopmental disorder in children. 80% of adults and 44% of children with ADHD have at least one additional mental health condition. 46% of women are misdiagnosed with another mental health condition disorder before being diagnosed with ADHD. So we get all that on the record to start with. Dr. Almagor, let's start with you. The main causes behind ADHD are what?
That's a question I get asked a lot, and it's a complex question. I can't answer it simply, and it's still something that scientists are working on. But it's called a neurodevelopmental disorder for a reason. The neuro part means it's brain-based, it's genetic, it's biological. The developmental part means it's something that evolves throughout the lifespan. So it's something that is also affected, like most genes, by the environment. And things, for instance, maternal smoking, drinking, maybe stress in the environment, things like lack of sleep can actually express the genes more fully.
Now, when you said genetic, I thought, oh, you inherited from your parents or grandparents. Is that the case?
Yes, often that is the case. In fact, if a mother has ADHD, their child has a 50% chance of having ADHD. That's pretty high. When I started in the field of ADHD, I started off as a child psychiatrist seeing kids with ADHD only. And mothers would come to me and say, you know, I've had the same type of symptoms like my kid when I was a child. And at that time, this is talking about the 90s, the early 2000s, we didn't even know adult ADHD existed at that time. So that's how the consciousness around adult ADHD started then.
One more quick follow-up here. We noted that it often accompanies one more mental health condition as well. Why is that?
Oh, that's something that I see daily and something that people don't realize about ADHD. They see it as maybe even something that's not even that serious, right? Like a little kid running around. ADHD has a huge burden for the person and society, and part of that is the development of other disorders that happen with ADHD, like anxiety or depression, things like substance abuse. A lot of that is about the kind of burden of untreated ADHD, and there's a lot of emotional dysregulation around ADHD, and that can end up just being after a lifetime of not being successful, a lifetime of failing at school, or having marriages break up, or not kind of go on to education as much as somebody could. People feel demoralized, end up feeling depressed, maybe turn to substances. So we see that all the time, and it's quite disheartening.
Heidi, I want to get a better understanding of how your understanding of this has changed over the years. For example, when we were kids and we were in class and we saw that one kid over in the corner, quote unquote, bouncing off the walls, we didn't know it was ADHD, but that's what he had. I think we now understand that that kind of hyperactivity and just constantly on the go, that's how we diagnosed it back then, even though we didn't know what it was called. How do you diagnose it today?
Oh, so it's a very lengthy process. Actually, we have Canadian practice guidelines on diagnosing ADHD. So it is as much ruling in the symptoms of ADHD and, looking at it as ADHD as ruling out any other disorders that could be causing those symptoms, called a differential diagnosis.
So process of elimination in some respect.
Yeah, so it's looking at the medical history of the child or adult. If you're an adult, you also want to get a lot of information on their childhood because, again, it's a lifelong disorder. It doesn't just show up in adulthood. So it's medical history, mental health history.
What symptoms are you looking for?
Okay, so are we talking children or adults?
Let's start with kids.
So that hyperactive little boy you talked about, that's one presentation of ADHD, which is the combined presentation. So it's dysregulation of attention is what we're really looking for. And these kids and adults can overfocus as much as they underfocus. So that's a fallacy about ADHD, that people can't pay attention. If something really grabs their attention, isn't stimulating, you can't break their attention, right? So they can focus for hours and time passes and they don't realize it's passing, right? So it's that dysregulation. Some people have hyperactivity and impulsivity and others do not. And it's very often the presentation without the hyperactivity and impulsivity that we miss. We miss diagnosing girls more often than boys because they most often have what we call the primarily inattentive presentation.
Are you looking for different symptoms in adults than in children?
Yeah, so, so often during adolescence, the hyperactivity decreases. We don't often see high school kids running around the back of a classroom, right? Like we do 5- and 6-year-olds. But a lot of adults I talk to talk about the hyperactivity internalizing it. So they're constantly feeling this restlessness, right? And their hyperactivity may be more subtle, shaking the leg, twirling the hair kind of thing. But in adults, we often see disorganization, forgetfulness, being late for everything, having issues at work, social issues as well as organizational issues, getting things done. And a lot of people, unfortunately, who don't understand ADHD see those symptoms as the person just being lazy or not trying hard enough.
Which is not the case.
Exactly.
Caitlin, you do get to speak on this program. Here we go. How old were you when you were diagnosed?
Yeah, it's a funny question because I was diagnosed as a kid, very young age, which as a girl, that's a little bit less usual. But I was first diagnosed with anxiety. So you mentioned that a lot of women are diagnosed with another mental health condition first, and that was absolutely my experience. I exhibited a lot of the symptoms that you see with the self-regulation, not just with my attention, but also emotions, impulse control, with that combined presentation of ADHD. So I had the tantrums, the meltdowns, the irritability if I was having a sensory overload that day. And that presented as a lot of just conflict with the people around me, conflict at home, and reactiveness. And so
How early in the game?
Age 6 or 7.
6 or 7, eh?
And so then that ended up with me accessing some mental health resources, getting a diagnosis with anxiety. And it wasn't until a few months after that where I was doing some follow-up on that with the anxiety meds when my doctor said, you're bouncing off the walls. Do you think maybe there's something else happening here? And so then I got the diagnosis closer to age 8, but still 7.
Did you think there was something off about you?
As a kid?
Yeah.
Absolutely.
You did. You could feel that you were different from the other kids.
Yeah, I was, and I think some of that might have been my own anxiety, but I definitely internalized this feeling that I was a bad kid. It was really hard to regulate my emotions, so I would say things that I didn't mean. I would make decisions that I didn't want to make. And no amount of telling myself not to do that again would change it. And as a kid, that's really frustrating. But you don't have the language at age 7, 8, 9 to articulate that. So I think a lot of the therapy that I went through as a kid was just unlearning that. Before I was able to manage the ADHD, I had to just be able to regulate enough and change my narrative about myself.
This has surely got to be one of the worst aspects of ADHD, is that a young child thinks of themselves as being bad. Not as being, having some issues to deal with, but being bad. What's the consequence of feeling that way?
I think that's one of the myths that we see around ADHD, is that the kid is just being bad. And that's one of the reasons sometimes people don't seek out a diagnosis. They feel, oh, that'll label my kid. But I think the labeling, being called it's ADHD, actually gives people a roadmap. It gives them something to do. It tells them, hey, the kid isn't bad. They have a condition. It can be treated. There's something you can do about it. So I think not knowing what it is, just seeing the behavior, often gets people labeled as being bad. Teachers will often say, hey, your kid is bad. They're disrupting the class. While getting help, just it helps that quite a bit.
How many kids you got?
3 boys.
3 boys. Any of them have this?
All 3.
All 3.
And my husband.
And your husband?
Yes.
So do you assume the boys got it from the husband?
Yes, although, I can probably see traces in some sides of, my background as well, from different people in the family. But
so these stories of kids going to school and being called bad kids, you experienced with that?
Yes and no, more so with my grandson. My 3 boys were all gifted, so they weren't failing school, so they were doing okay. But the interesting thing was they had enough inhibitory qualities that they saved it all for us at home. So they would be okay at school, and then they'd come home and all hell would break loose. Like you can imagine 3 boys with ADHD in a household with one of the parents with ADHD. So when I present to parents, I always say, I really, really wish I knew then what I know now. Life would have been so much easier for everybody and so much better for the kids.
Tell us what that means. If you'd known then what you know now, how would things have been different?
It would have been advocating in the school system to get them, the help they needed. They weren't failing, but they also weren't diagnosed and got the support as being gifted, right? So they did fine till they got to post-secondary, and then it was kind of like a 2x4 between the eyes, right? Because all the organizational difficulties, the time management, all of that stuff really hit them hard because they didn't have to do a whole lot of studying until then, right? So, and yeah, the emotional dysregulation that Caitlin talked about, and that was, a lot of our family life's experience, different kids dysregulating and a lot of fighting.
Yeah.
But all boys fight, so that's not necessarily a telltale sign of anything.
And interestingly enough, that is what the early doctors told us, right?
They're not wrong about that.
Yes, and they just said, oh, they're very active boys and they're very bright and they're, right? Which they were, right? But it really became difficult that,
You are a university student now,
Yeah.
so you've clearly figured out how to deal with this. Is that fair to say?
Yeah, I think I learned how to deal with it at a pretty young age, and I sort of went from this pipeline of the experience I described before at age 7, 8, 9, thinking I'm bad, to very quickly unlearning that and the anxiety kicking in about how I was going to be perceived by those around me. I really didn't want the world to see me as bad, so I worked really hard, and I think I had the privilege of being able to mask some of those symptoms, and I also had the privilege of having a really supportive environment throughout elementary school and high school, and I learned self-advocacy skills. So between all of that, I was able to apply to the University of Guelph, and I've been pretty successful so far. I'm in my 4th year, planning to graduate soon, but I will say that my success isn't attributed to just me learning to manage it. I have developed skills. I can self-advocate, but I'm learning to live with the ADHD. It's not something that I overcame, and I've also learned to adapt my environment to better support my needs and surround myself with people who can hold space for that.
So you tell me, you don't think you've been cured of this. Is that fair to say?
Absolutely not.
You're not?
I still very much have ADHD.
You do.
Yeah.
But you manage it both by self-regulating and meds too, I assume?
I do take medication. I think that's one facet of the treatment plan that I have. I do see a counselor and have been in therapy for a really long time. And that's been huge for the emotional regulation and self-management piece. But again, I think a lot of the success, I say success because there's not one definition of success, and that's another issue within the ADHD community. But I think my own success and the pathway that I've taken is largely attributed to having access to the support resources that I needed from a very young age, in a way that was able to help me get to the point where I am now.
So she's never going to grow out of this. Is that right? When you've got ADHD, you've got it for life?
Well, that's the definition of ADHD, but I also want to say, Caitlin's success, I think it's because you were able to get treatment and be identified from an early age, and you've been also sticking to your treatment. So good for you for that. And I can see the results now. You're in university and doing well, and that's often we see people with ADHD can do amazingly well throughout their life if they get treatment, if they're identified. So yes, it's not something that's going to go away. You could call it a neurological difference, and someone will have it from birth to life, but they can do very well if they can get the right treatments and the supports. And the treatments can be medications, they can be psychotherapies, and the supports need to be around education and at work. When we really see a lot of success, when we get all four things going together, we treat the biological, we treat the psychological, we treat the environment, and we also look at things like work and the school environment as well.
What kind of diagnostics are you using in order to get there?
In terms of diagnostic,
Yeah.
in terms of getting there well?
In terms of to diagnose it in the first place?
Yeah, well, Heidi went over some of the diagnostics. We don't have a blood test. We don't have a brain scan. And so we do have to go over a very careful kind of diagnostic process, an interview, trying to understand what's going on for the person, what their symptoms are, and could anything else account for the symptoms as well.
Anybody working on a blood test?
People are working on a blood test. People are working on brain scans. Now, right now, we can show brain scan differences between populations of people without ADHD and people with ADHD, but it's not sensitive enough to work in terms of one person per se. That'd be great, but I think with any complex behavioral type of kind of problem, it's going to be more complicated than that, and nothing really beats kind of talking to somebody and understanding what they're going through. That's going to probably remain the gold standard for a long time, I think.
If I can just add
Please.
to that, yeah, I think also, I'm going to challenge you on your questions a little bit here,
Please,
if that's okay.
of course.
I think it's important to talk about treatment, and I really like that you talk about like that multifaceted approach that addresses, your intrinsic needs as well as your environment. And I think that's kind of what I was getting at as well with the supports that I received growing up. I tend to avoid language surrounding things like fixing ADHD or a cure because, again, like you said, it's a difference. It very much is a disability as well, and you need that label, especially for advocacy, to recognize the validity of it and the need for accommodation. But you can also examine disability through a social model and lens to view the way that circumstance and environment play a role and in how somebody is able to thrive. And so as much as it's good to talk about treatment that's most effective and do research on things like blood tests and understand what's important, ADHD Awareness Month is also about being aware of how to make the world more ADHD friendly rather than just making ADHDers more adaptable to the world.
Understood. Yeah. You are a psychology major.
Yeah, can you tell?
I mean, presumably you are interested in this subject because of your own personal history.
Yeah, that's definitely driven me kind of toward this path, but I think, I've always wanted to be a clinical psychologist, and being an undergrad has sort of shifted my thinking. I think I want to go more into advocacy for both neurodiverse communities and also like other issues as well.
This is a good thing. You're a great communicator. And a great advocate, too.
Thank you.
And I'm sure you're going to hear from people who are watching this who are saying they want you on their team by the time we're all said and done here. Okay, let's move on here. Women, we've noted, are often misdiagnosed.
Yes.
Why is that the case?
Women very often present differently. Girls present differently, not so often with the hyperactivity. Women tend sometimes to have more of the emotional dysregulation, especially in adolescence and going through hormonal periods, per se. And I think family doctors are very good at diagnosing anxiety and depression. And as Dr. Almagar said, when you don't treat ADHD, you get anxiety and depression. So those two things are diagnosed. And we did a survey a number of years ago, and we had women who, for decades, were being treated for anxiety and depression unsuccessfully because their underlying ADHD was not diagnosed.
So we need to work on that.
Yes, very much.
Can I add to that?
Please.
And often with women, and Heidi was saying that people present often with hyperactivity when they're children, but inattention when they're adults. But women tend to have more inattention on balance than men when they're kids. And inattention tends to be more silent. It's more internal. And if a girl is smart, she's trying hard, she's in the back of the class, that inattention might not be noticed by teachers. Teachers often look only at grades. And people with ADHD can be, they can be very high, have very high IQs, do very well in school, so they may never be noted by anyone. Inside, though, they're not feeling that. They're feeling anxious. They're trying harder. They're trying to master ADHD. That puts stress on them. They can continue in the system for a while, not be identified, but usually there's some breaking point that can happen maybe in later high school when demands get greater, maybe in university, maybe when they're mothers and have to take care of a family, or maybe even during menopause when hormonal changes can exacerbate ADHD. So what we see is that women tend to be diagnosed later than men, and because of that, they actually have a higher burden of ADHD than men. And surprisingly, and this is something that everybody has been shocked by in the past few years, studies have been showing that women have higher death rates from ADHD, higher accident rates, higher substance use rates than men in ADHD.
Okay, Heidi, come on in here. Again, people of my generation, their exposure to ADHD came before we even knew what to call it. So lots of myths have developed over the decades. What's something that ought to be dispelled?
I think what upsets a lot of families dealing with ADHD is the blame the parents get. And, a lot of people who don't understand it think the parents are not trying hard enough. They're lazy. They haven't disciplined these kids. These kids just need to learn right from wrong, all this kind of stuff. Actually, I can tell you from personal experience and talking to thousands and thousands of parents over the last 30 years, parenting a child with ADHD is hard work if you're going to do it right. And the parenting is much, much more difficult than if you have kids without ADHD, and I wish people understood that and did not judge parents with ADHD. And for some reason, people who have very little knowledge about ADHD feel they have the right to tell parents to medicate or not medicate their kid, give their kid more exercise,
Why do they do
less
that?
TV. You know what? I have been pondering that for like 40 years. I don't know why. I mean, if a child had some other medical disorder, they wouldn't tell them to take the kid off insulin. It makes no sense, but for some reason, it still happens.
When you met the man who would become your husband,
Yes.
I mean, they didn't call it ADHD back then, did they?
No.
No. So you found out after the fact, I guess, or
Well,
it has
after the kids were diagnosed, and that's
I see.
very, very common that the adult gets diagnosed after the children.
I see. Okay. What else? What else should be on this list of myths that we need to get over?
Well, we've got 100 myths around ADHD, and things have been getting better. There's been more education around, but there's quite a few around there. I'm going to come back to one you kind of mentioned, Steve. You said to Heidi, don't all boys fight? And that's something that goes on a lot. And people often will say, around that, they'll just grow out of it. Just wait. Don't do anything. They'll just grow out of it. Boys fight. People, they're not old enough to focus.
But that is true, isn't it, Dr. Almond? I mean, some of them grow out of it. Some of them eventually stop fighting.
So if it's kind of regular fighting, sure. But what we see with ADHD is beyond that. It's something that, it's not just something that you would see just kind of the regular fighting on the playground. You see kind of chronic dysregulation around their emotions, around their activities. So it's more than just that. And just letting it kind of, waiting till people grow out of it doesn't work. What we see is that you really need early intervention for ADHD.
Early meaning what age?
The early age would be below the age of 8 is when you really can see good results later on. If you can treat before the age of 8, you can prevent a lot of the complications that happen later in life. After age 8, you can treat after the age of 8. I tell people who are even at age, later adult senior citizens, it's never too late to start treatment, never too late to actually get the right treatment for yourself. But if you can treat at very early age, you can actually do much more for later life. So earlier is better, and often, unfortunately, people say, no, let's wait. We want really to wait until treatment is our last resort. But that actually doesn't do the child any service, and then you start seeing a lot more complications as people get into adulthood.
Got it. You got siblings?
I do.
What do you got?
I have a brother and a sister.
How fractious a household was it when you three were growing up?
It was lively. There was definitely a lot going on. And I think also like the whole idea of like boys fight, that dysregulation may present as fighting. It can also be like that internalized spiral. It can be overthinking. It can be meltdowns. It can be conflict. It takes a lot of different forms. So I think narrowing it down to one form and saying, well, like this can be explained by something else really does not reduce ADHD or like the complexity of that experience.
All right, given that you've lived this,
Yeah.
are there any other myths that you've run into along the way that you think need dispelling?
Yeah, I think the myth that like you can't be smart and have ADHD. ADHD really has nothing to do with your capability to, you know, achieve cool things and do something that you are passionate about. And I see so many people in my life who are neurodivergent and successful in their own way and fantastic. And I think some people have the experience of being told that because they have ADHD, they can't achieve things. I found, especially like around high school age, that because I was achieving things, I couldn't have ADHD. And that was an interesting one because there's kind of this like conflict of feeling like, okay, so if I do well, then all of a sudden my disability will no longer be recognized. And that's a myth that I've been trying to challenge for a while.
Interesting.
Can
Please.
I just add something about treatment? The difficulty with assessment and treatment for ADHD is long wait lists. A lot of what we call, multimodal treatments for ADHD are not covered by provincial healthcare plans. So sometimes even getting an assessment, you have to pay over a WIP. Cost per se, especially for adults. It can be very, very pricey, thousands of dollars. Actually finding physicians to prescribe medication can be difficult. A lot of family doctors don't want to do it. But then you've also got the cost of the medication. But at least getting the prescription is most often covered by healthcare plans. Psychotherapy, coaching, a lot of the things that we do have research that shows it's very helpful are not covered. So a lot of people are not getting all the treatments they should be getting. Also in the school system, we talk about, recognizing ADHD, getting supports in family life in the school. A lot of that is not being done. In Ontario, we do not recognize, unfortunately, the Ministry of Education does not officially recognize ADHD as a disability. So these kids don't automatically get the right to special education resources. And I spent a lot of my time advocating.
You think it should
that.
be recognized as a disability?
Well, yeah, we recognize autism. We recognize learning disabilities that are both neurodevelopmental disorders. And those kids have the right, they're what we called IPRC'd or recognized as a child with special needs.
I used to know what that stood for. Independent Placement Review Committee?
Yeah, individual placement.
Individual,
review. Yeah.
okay.
So, but these kids with ADHD, and very often the symptoms and the presentations overlap with how kids with autism present as well, right? So why should one neurodevelopmental disorder be recognized and another one not, right?
Can I get you on that? How well do you think the school system does at dealing with all these issues?
I think it's hit or miss, and it depends on like the funding and the resources available within a certain community. And I can really only speak to my own experience. Heidi knows a lot more about the province-wide landscape. My experience was that I got a lot of support in high school and in elementary school.
Where'd you go?
I was in private school in elementary school, and then I went to a public Catholic school in Burlington.
And it was okay? Or
I had a good experience. I know, though, that not everyone does. And I saw firsthand what my privilege granted me. And I think being articulate about my experience, knowing my needs, and having self-advocacy skills, helped me succeed and get the help that I needed. But I also saw other students, especially Black and racialized students, not being treated with necessarily as much respect or like belief in their experience as I was. And so, people would listen to me when I could advocate for my needs in a civil and articulate way, but having that ability should not be a requirement to like having human rights. So that's my take. Yeah.
Got it. Do you have a theory as to why this is not recognized by the school system as being something worthy of additional help, whereas other neurodivergent situations are?
When I tell parents that ADHD doesn't count as an exceptionality in the school system and they can't get an IP just on the basis of ADHD, they don't believe me. I have to explain it over and over again. So it doesn't make any sense. It's a historical kind of circumstance. It doesn't actually make any sense today.
Well, I don't know this, I'm just guessing here, but is the ministry concerned that if it did recognize this, it would be absolutely flooded?
I don't know what the ministry's thinking is. I think it was part of the Educational Act when it was formulated. It wasn't considered to be an educational exceptionality at that time. And I know that organizations like Heidi's have been trying to get it on the radar, but they've been not successful doing so. Often, I'll try to advocate personally by writing letters to the school, but that's been harder and harder to do, and schools have been very resistant to kind of formulating IEPs for students with ADHD. So often parents have to resort to private schools, which is not doable for a lot of parents. Sometimes when we have an added exception, an exceptionality, an added diagnosis like autism, because as we've said before, ADHD doesn't travel alone. It often goes together with other things. Sometimes it's actually a relief. It helps to actually add a learning disability to ADHD.
Because then you can
they
get
can
that
at
extra.
least get the help at the school. It's a bit ironic, but that's how it works.
Follow up with the healthcare system. How well is it doing right now at accommodating the needs of people who require medication or whatever?
I'm not aware we have a healthcare system when it comes to mental health in Ontario. To be blunt about it, I've never seen one.
What do we have?
In my years?
Mental health industrial complex.
I'm not sure to call that. It seems to not even be as organized as such. It just seems to be a number of different a lot of well-meaning practitioners, great hospitals, great people, but there is no kind of central kind of organizing principle behind it. So we are stuck with a lot of waiting lists everywhere in trying to get ADHD treatment, diagnoses. There's very little in the healthcare system for the kind of allied health professionals that do ADHD coaching or psychotherapy. So it's very hard to get that kind of integrated treatment that you really need. So that's something that we see.
What was the situation with your boys in terms of treatment in the healthcare system?
The oldest was diagnosed at 14 and a half, and it took 2.5 years and 5 medical professionals to do it. So, I mean, it took persistence. It really took a lot of persistence. And, and then the other two within 2 years were also diagnosed. But, understanding the system, or lack of system, right, as to where to go, where to get the supports. And really, to be honest, that is why I founded CADAC. Because when I went through it, there was none of that. There was no training for parents, there was no support, there was no information, there was no supports for youth, adults.
You've talked about
nothing.
digging into your pocket. How much, have you got a guess at how much it has cost extra over the years?
Oh, I don't know, 100,000, 150,000, like a lot. If you're going to, pay for, psychology.
Is that all together or each kid?
Cocaine. You know what? I don't even want to think about
I don't blame you.
What I said to my kids was the one nice thing they did for me. It was almost like they took turns having crises. They didn't all do it at the same time, but I mean, I'm talking from early age through university years, into young adulthood. So a lot of ups and downs, and yeah.
So the reason I use the industrial complex language, and some people might call this a radical take, but I think the amount of money that you need to have to get that help in the first place is the reason why my outlook has changed. Because as much as I've had really good supports, I had family members who could afford therapy, who could afford a school that I felt really safe and welcome in. And so not everybody has access to that, and as a result, the people who are wealthier, people who are higher class, are going to get better access to more support, and the people who might need it the most have the least access. And so there's that gap, and the healthcare system that we have doesn't account for that either. So.
We're down to our last minute here. If you had Sylvia Jones's ear for a minute, what would you tell the health minister about what we need?
I would tell her three things: reduce waiting lists, reduce waiting lists, reduce waiting lists. And I think you can do that by training more people to diagnose and treat ADHD. I think that would be a really good first step. And there's organizations that the ministry can support that are set up that can help with that, like Heidi's Kadak. So I think that would be my main message to the minister.
Have you given that message in the past?
We have. We've lobbied. I've lobbied with Heidi in Queen's Park.
What's the reception?
The reception is polite, but other priorities are there, and will call us back next week. That's been the reception over the years. I think I don't want to say we've made no headway. We have, but it's been very, very slow progress.
How about for you? If you had 30 seconds to bend the ear of the Minister of Health or Education, what would you say?
I think both ministries need to take ADHD more seriously. I think they think it's, just a throwaway kind of disorder. They don't take it as seriously as they do autism and learning disabilities, and it's a shame because it costs our society a lot when we don't recognize it.
You get the last word.
Yeah, that's an honor. I think there should be more of a priority in funding mental health services for everybody who needs it. The privatization of it makes it really difficult for people to get the help they need, not just with ADHD, but any mental health experience, and having that available helps everyone.
Awesome. Great discussion, everybody. Thank you very much to Heidi Bernhardt, founder for the Centre of ADHD Awareness Canada, CADAC for short, and on the other side of the table, Dr. Duran Almagor, psychiatrist, and Caitlin Weinstein, psychology major, University of Guelph. Thanks so much, everybody.
Thank you.
Thank you.
It's been several years since we've had Sharon and Bram grace our studio where they performed their classic Skinamarink with the help of quite a few TVO producers, I might add. Now they are back with a new album called Elephant Showstoppers, and it brings Sharon, Bram, and Sharon's daughter Randy Hampson to our studio, and it is so great to see you guys again. Thank you so much for making the trip back.
We're happy to be here.
It's a thing of beauty. Now, 5 years ago you were here and we were talking about your farewell tour. And now you're here talking about a new album. So
you can't get rid of us.
Something didn't happen along the way.
Exactly.
Which is what?
Randy.
Oh, Randy. Do we have you to thank for this mischief?
Well, I'm just trying to keep the music of Sharon, Lois and Bram in the minds and hearts of yet another generation of fans and friends.
That sounds like a good thing to do.
It is the most delightful, rewarding, enjoyable, fun job I could ever ask for.
And you'll notice that she said Sharon, Lois, and Bram. She's gone, 2015.
Lois died of a
She
rare form of
died,
cancer in 2015.
But she's still there with us.
Should we show the picture? Sheldon, bring this up here if we can. We're going to show the picture of Sharon, Lois, and Bram. There they are. Lois Lilienstein, bottom right. Look at you guys. I should ask this question. You know, the Beatles were happy for a while and then they broke up.
Yeah.
The Stones were happy for a while. They're still together, but, they've had their...
Roughly.
Exactly. You guys always look so happy when we saw the three of you together. How much of that is showbiz and how much is the real deal?
Two things. First of all, we really liked each other. We still like each other. And I think that's what keeps groups together or separates them when they don't like each other. And we loved what we were doing. We loved making music. We loved connecting with families. Nothing could be better than that. So that's a reason to smile.
Okay, that's your take. Let me get your take.
Well, I feel...
Just say ditto.
Ditto. Well, she ditto. I ditto too.
There was a friendship beyond the professional association?
There was a friendship there. And also, when we started together, we were adults. We weren't kids. And so we stepped into this whole thing with kind of an idea about how to be together. We weren't experimenting anymore with getting along. We knew that we did, and we did.
We're very, I mean, Lois's son David is a month older than me. We grew up together from the time we were 3. We're best friends. Bram's brother Jeff, a very dear friend of mine. He sometimes, when my mom and I play concerts together, he will join us on stage and play mandolin for us. And we like each other outside of the business. I mean, there was always the fun and delight of being together when they were performing and touring. But outside of that, we marked New Year's together and all of our special occasions. And Bram lived 3 doors down from me for, 10 years. And we're like, it's family.
Well, I'm going to ask both of you the same question from opposite sides of the coin. Was it always secretly your hope that someday your daughter would perform with you?
I never thought of that. I never imagined that. I mean, she had another career. She was a family lawyer. She is still.
But always involved in music.
Always involved in music and always involved in our music. And she did research. She worked for the company. She gave us a lot of songs that ended up on records or in TV shows. So her involvement was constant. But her role with us, I never kind of imagined, and it's perfect.
I'll ask you the same question. Was it always your hope secretly someday to sing with your mom?
When I was 3, she used to sing this song called Mommy What If, and I would do it as a duet with her. I mean, they recorded it, not with me because I was too big by then. But people started telling me, when Bram said he wanted to retire, people started saying, you should sing with your mom. And even Lois saw it. She was unable to do a charity appearance and said, get Randy to do that with you. But my mom came to it reluctantly. She was nervous about it and she was unsure. And COVID helped us get there. We started singing together on Facebook Live, just
in the living room
to do it, and then we did Zoom concerts, and it sort of went from there.
With much encouragement from Bram.
Yeah.
Okay, now let me ask about you.
Yes.
Because you're not touring anymore,
No.
but you're still with the thing.
Yeah.
So what do you miss by not touring?
Well,
Probably
my
nothing.
energy level is way down. I don't think I could do it anymore. So that was part of it. It's hard.
It's hard.
Really, really hard, and you know it. And so I couldn't do that anymore, but I really wanted to be part of it. I mean, the music is central to it. And so I'm still involved in putting the music together when that is appropriate, and receiving the occasional pat on the back.
Well, am I allowed to ask, how old are you now?
In December, I'm going to be 84.
84?
Yeah.
You're a young pisher. What are you going off the road for?
Yeah, and she's a lot younger than me.
I'm 81.
Oh, my goodness. She could
Years
practically
younger.
be your daughter. She's so much younger.
It's true.
Right.
Yeah.
I keep telling everybody else that she's 81, and then she says, I think you forget that I'm 81.
She
sort of
pushes me out there.
just push her in.
But Randy, I mean, how old's Mick Jagger? How
I
old's
know.
Ringo Starr?
Exactly, and they're
Paul
incredible.
McCartney.
Yeah.
You guys in your 80s are not that old anymore.
I'm so happy that we're living in a time when old people get up on stage and are impressive, and the audience wants them. I think it's terrific.
Yeah.
Well,
And Bram does, if something special is happening.
Like this.
Yeah.
This is special.
Oh,
Yes.
yeah.
shall we
yes.
show it? Okay. Can I show? Here, Sheldon, you got this here? I'm going to bring up this. That's the new album.
Yeah.
This is the new album. There's a nicer shot of it there. And, okay, Sharon on the left, Lois in the middle, Bram on the right, the omnipresent elephant at the bottom.
Right.
And it's Elephant Showstoppers. That's your new thing. Bram, what can people expect from a new album brought out by a few people here who've only been in the business for about 60 years?
Okay.
What do we
let's-
expect?
Let's define new in this context.
Sure.
Because obviously it's not brand new because Lois is in all of them or most of them. What's happened is that a couple of people who are huge fans
And part of our team.
and part of our team said, you recorded a lot of songs for your television series that got put on the shows, on the air, but never got put on recordings for people to come back to. So everything on this recording is from the first series, Sharon, Lois and Bram's Elephant Show, and now we've put it together, side A and side B, which used
real record.
used to be the way it all happened.
That's a real LP.
It's
How
a
about
real
that, as we used to
LP.
call them back in the day.
Exactly.
That's a real LP. Vinyl, I guess they call it now.
It's full of treasures.
Yeah.
It's the first vinyl in 23 years. And, you know, my mom always talks about how children would connect with the images on the cover of the album and know that these are the people singing the songs.
Walk around holding the album. They felt the connection.
When you hear a streaming song on a platform, you don't see the pictures or anything like that. But this is full of treasure. So even if you don't have a record
Oh, look at this.
player,
He's opening it up. Okay.
It's got a
Oh,
poster
man, will you look at
inside.
that? Look at that. Look at you guys.
I mean, you think this is big.
That's
four
big.
times as big.
That's beautiful.
And on the other side of that has song lyrics.
Oh, yes, it does.
Stories behind the songs,
Yeah.
and then pictures in the film strips of behind the scenes and pictures that have never been seen before. So even if you want to listen to it on streaming, it is a treasure without a record player.
I don't have one. I've never heard it.
Well, yes, you have heard it, but not
No,
from
I
the
mean,
album.
I haven't
You
heard
haven't heard
this
it on
Yeah.
vinyl.
played on a record
course.
player.
You two and Lois were such a huge part of the history of this station, of this place.
Yes.
And I want to go back 40 years. Are you ready to see yourself 40 years ago?
Oh,
Yeah.
wow.
Okay,
Wow.
Sheldon,
Always.
roll it, please. Now,
Love
people watching this will not have heard Bram say, "I look the same."
They won't?
Well, now that I've told them, yeah, yeah,
I
yeah.
do.
That's what you. When you saw yourself, you said, "Hey, I look the same."
Yeah.
People
Yeah,
are
you
so
did.
devoted to that show.
How did that come together in the first place?
This is a very sweet story. We had a little celebration of the launch of the album, the vinyl, and Arnie Zapersky, who along with Bruce Glosson produced The Elephant Show. And Arnie came to that party and he said, because I told the story about how people used to come to us and say, well, would you like to do TV? And we'd say, sure. And they'd say, have you got money? And we'd say, no. And they'd disappear. Arnie and Bruce came to us and said, would you like to do TV? They were young guys. They had no children. They had nieces or nephews. That's how they knew. They were just out of film school. They said, would you like to do TV? And we said, sure. And they said, have you got money? And we said, no. Have you? And they said, did they say no?
They said yes.
They said they have a little money.
They didn't.
They didn't, but
They
they.
figured they were
They
going to go and
figured
get
it
it.
Okay.
And they did. And he told us that his brother, Arnie's brother, was a doctor, and he went to his doctor friends and asked them each to kick in $2,000.
No kidding. And that's how it
Yes,
started.
yes.
Wow. And lasted how long?
We ran the show for 5 years, and then it ran on Nickelodeon. I mean, we shot the show for 5 years,
Yeah.
and it ran much longer here, and then on Nickelodeon for I don't know how long.
Lives forever.
Yeah, and that was the first of the series, and we had another series
Yes, of
called
course. Skinnamarink TV.
Skinnamarink TV.
TV,
Yeah.
which had more doing in it than it had two characters, and they had voices.
The thing, you know, on Elephant Show, our elephant was gender-free.
Right.
Not a she, not a he. And it was a kind of relaxed decision. It was like, we want every little kid to be able to connect with Elephant. And so we never did he or she. And boy, were we ahead of the time.
Yeah. Kind of like the Pokeroo at this place.
Right.
The Pokeroo is gender neutral as well. Now, tell me this. If you go to a rock and roll concert nowadays, you see a lot of people in their 60s, 70s, and 80s, right? Who, of course, grew up with all the music.
Amazing.
How about your shows? Who's in the audience at your shows?
It's 4 generations now.
4 generations.
Yeah. Bram would say that 5 have grown up on Sharon, Lois and Bram now, but we get babies, and then we get the kids who grew up on the show who are now bringing their children and their parents and sometimes their grandparents. And so we really have expanded, but we've also got a lot of adult fans. Bram made an appearance at Fan Expo with us this summer, and there were 500 people in the crowd in cosplay outfits, and
No
it
kids.
was probably 95% grown-ups.
That's right.
Yeah.
That's right. But it is 5, you know.
Yes.
It is 5
It is
because
5
there was
generations.
3 right off the top. Because at our concerts, the first concerts, you had the kids, you had their parents, and some grandparents.
Yeah,
There's
sure.
3 right there.
Yeah.
And then add
All these
2
years.
more, all these years, at least 2 more. Could be 6 by now.
I got to ask you this, though, Sharon. In an age of social media, when there is so much, I don't even know how to begin to describe it, but there's so much toxicity and there's so much bad stuff that kids can get a hold of. Why do you think this stuff is so eternal? The songs that you sang, the way that you did it, why does it work all these years later?
I think because the music is good, really good. That was a fundamental value that we shared. Good arrangements, good songs, good musicians, the whole thing. I think because it engaged the whole family, that it was something that they could share. And these days, it's hard for people to find sharing. And
Here's my theory.
Yeah.
A lot of what we do is folk music. It started in the 1800s, maybe in the 1700s. We don't know. It's anonymous. But it survived all of those generations. If it was a crappy song, it got forgotten. If it stayed alive through all of those generations, there's got to be something for it. You know, She'll Be Coming Round the Mountain seems like stupid simple to us, but it's a good song.
And still singing it all these years later.
yeah, from the first record.
Yeah.
So
We're still singing songs from the first record.
Yeah. So you know that we're on TikTok and Instagram and Facebook, and every now and then we'll post a Skinnamarink. The views are in the millions and millions. And people, why am I crying? And I can't remember what I had for breakfast, but I still know all the words and actions to this song.
And they say memory unlocked.
Yeah.
I love that.
I needed this today. My grandmother sang this to me. She's gone. It made me happy to think about her. Like just all of these messages.
You met the young producer who is producing this segment, Maya Abramson, before we started this.
Right.
Do you know how verklempt she has been over the last few days in anticipation of this? I can't tell you. She's sort of been overcome with emotion about the whole thing.
We meet people who are teary.
Yeah.
And they're embarrassed. And I always say, don't be embarrassed. You're having happy childhood memories.
Yeah.
That's a very good thing.
It's a beautiful thing. Do I have this right? Did you play the White House once upon a time?
Yes, we did.
You did?
1992.
So Bill Clinton is president?
Yes,
he
and we
was,
met him.
And
You met Clinton?
We met both of them.
Yeah.
Both meaning?
Bill and
Husband.
Hill.
Oh, Bill
his
and Hillary.
And
Okay.
his wife, whoever she might be.
Yes.
It
was very exciting.
We have a photo to prove it.
Yes, we have a photo. We weren't allowed to use the photo for publicity for all those years, but it hangs on my wall, and proudly so. We were thrilled to meet him.
I think it was just during his presidency. Like that was once he wasn't president anymore, you could use it.
Oh,
I don't
we
know.
haven't thought about that at all.
We never used it. We never used it in that way. But we
No.
had, and Bram, are you going to tell your story?
I don't know which story you mean.
The memento.
The one that's in my washroom.
I'm sorry, I still don't know.
Oh, Bram came out of the washroom. We came into the White House. We had a little brunch with all the guests.
one.
With all the guests before we met the Clintons. And Bram went to the washroom and
I stole.
What?
I stole paper towels that had the stamp of the President of the United States on
I
it.
said to him, you know they were watching you take that. And he said,
He said, everybody takes them.
that's why they're not cloth, they're paper.
Hang on. What the
RCMP.
the FBI is on the other side of that door. They want their toilet paper back.
too late.
That's wonderful. Okay, the last time you were here, you know you did a song. So, of course, we're going to impress upon you to do us a song again before you leave. What do you want to do?
Will you do it with us?
You know, if I
he
can
knows
remember
it.
all the hand motions, let's see.
Maybe there are others here who will join us as well. And we could sing you the new version of it, which is part of our Skinnamarink book.
Let's do it.
Yes, okay,
Let's
we'll
do it.
start.
Who's
I'll
gonna-
start it.
you're gonna-
I'll start.
And we'll follow the key.
Yes.
Okay.
Yes, exactly. Here's a little ditty that we all know and sing. We share it with our families and let our voices ring.
It also has some actions. They're really fun to do.
And now we'd like to sing this special song with all of you.
Boom, boom, boom.
Skinnamarink-y dinky dink, skinnamarink-y doo. I love you. Skinnamarink-y dinky dink, skinnamarink-y doo. I love you. Put up the sun. I love you in the morning and in the afternoon. I love you in the evening underneath the moon.
Oh, skinnamarink-y dinky dink, skinnamarink-y doo. I love you.
We love you, Steve.
I love you.
You're all terrific.
I love you.
We'll see you next time.
I hope.
I love you too. Boo boo be doo.
Okay.
You guys have still got it. Outstanding. Thank you so much for coming in. This is so wonderful. We do so much death and destruction on this program. It's so great to
know.
do something as lovely
What
as
a
this.
pleasure
Happy
it
is
is.
good.
Flew
Thank you.
by.
Thank you. That was a joy.
You are perfect.
Back at you, lady. Okay. Thanks so much, everybody.
Thank you.
And that is the agenda for Wednesday, October 16th, 2024. Tomorrow, former cabinet minister and astronaut Marc Garneau on his life in space and in the House of Commons. I'm Steve Paikin. Thanks for watching TVO, for joining us online at tvo.org, and we'll see you again tomorrow.